Уважаемые коллеги, здравствуйте. Я прошу прощения за технические проблемы. Вот у нас, к сожалению, с Украиной не сработала программа вебинар, и в последующем, наверное, мы будем все-таки работать в Zoom, потому что люди звонят, люди расстроены, что не получилось. Безусловно, по техническим, те, у кого были технические проблемы, сертификаты мы сделаем, и ссылку на лекцию мы предоставим. Данный вебинар есть стартовый, мы посмотрим, как у нас получится в дальнейшем. Мы планируем с профессором Кристианом Дилем проводить по одному вебинару в месяц и приглашать на них интересных лекторов из разных стран. Вот. Давайте, наверное, начнем с моего доклада, а в дальнейшем мы уже послушаем профессора Дила. Я расскажу про изменения на коже у пациентов, как ранний постковидный синдром. Уже больше 1,5 лет с осени 2019 года мир традиционно и неожиданно столкнулся с пандемией COVID-19 и вполне традиционно в очередной раз оказался явно не готовым к активному противодействию развившейся очередной вирусной эпидемии. Она внесла существенные коррективы в повседневную жизнь фактически всех стран мира. И, пожалуй, именно это наиболее заметно в изменении отлаженного быта и производственной активности наиболее развитых стран мира и Европы. Появился новый термин «постковидный синдром» – изменения в органах и системах, которые сопровождаются ковидом, включающий в себя также видимое поражение кожного покрова различной локализации. Изменения кожного покрова, как известно, могут носить самый разнообразный характер, могут даже в ряде клинических ситуаций имитировать различные известные нам заболевания кожи и отражать неудовлетворительное состояние ряда органов и систем организма пациента. И вот на данном слайде представлена информация от Европейской академии дерматологов осеннего онлайн-конференции, то есть уже когда, соответственно, мы полгода были на карантине, про поражения кожи, которые встречаются при ковиде. Существует достаточно много классификаций, много публикаций уже на эту тему. Вот одна из публикаций в британском журнале «Дерматологии», которые предоставили информацию о различных симптомах, которые сопряжаются с поражениями кожи в том числе. И на данный момент существует одна из наиболее принятых, из наиболее известных классификаций изменений на коже при ковиде. Это когда поражается акральная область, эритема, отек с единичными пузырьками и пустулами в 19% случаев происходит. Другие везикулярные высыпания в 9% случаев. Некоторые из них располагаются на туловище, состоят из небольших мономорфных пузырьков на одних и тех же стадиях, в отличие от полиморфных пузырьков при ветряной оспе, например. Они также могут поражать конечности, иметь геморрагическое содержимое, увеличиваться в размерах или распространяться по всему телу. Крапивница в 19% случаев. В основном они располагаются на коже туловища, сгруппированно и рассредоточенно. Могут располагаться также на ладонях. Другие макулопапулезные высыпания, 47% случаев. Некоторые были описаны как похожие на розовый питериаз. Иногда также присутствовала клиническая картина высыпание, характерное для пурпуры. И последнее – это ливида или некроз в 6% случаев. У пациентов наблюдалось поражение различной степени, которые предрасполагались к окклюзионные сосудистые заболевания, включая области ишемии. Ну и далее пару слов о том, что было сделано нами. Совместно с коллегами-реаниматологами и инфекционистами мы, как дерматологи, наблюдали у ряда пациентов с подтвержденным лабораторно диагнозом COVID-19 появление на коже высыпаний, которые можно было характеризовать как розациоподобные. Причем у одних пациентов подобные высыпания проявлялись на фоне уже развернутой клинической картины, а у других это проявлялось как постковидный синдром. Причем у большинства из пациентов все-таки это уже при отрицательных тестах COVID-19, когда заболевание, собственно, уже было вылечено с точки зрения инфекционистов. У большинства пациентов, у которых наблюдалась подобная симптоматика, также из сопутствующих заболеваний можно было выделить гипертоническую болезнь, ожирение, сахарный диабет. И вот несколько клинических случаев. Такая пациентка, 64 года, заболела остро, высокая температура до 40 градусов. Температура ничем не коррегировалась, и пациентка принимала противовирусные препараты. На 7-й день болезни, когда температура уже давно спала, появились вот подобные высыпания. В анамнезе диабет, гипертоническая болезнь, ожирение. Следующая пациентка, 64 года, заболела остро, тоже высокая температура до 40-41 градусов, тоже ничем не коррегировалась. Высыпания появились на 8-й день болезни, опять же, когда температура снизилась до нормальных цифр. В анамнезе также гипертоническая болезнь, ожирение. Пациентка 69 лет. Заболела остро, высокая температура до 40 градусов, высыпания появились на 14-15 день болезни, на фоне нормализовавшегося общего состояния, нормализовавшейся температуры. Оставалось единственное, что общая слабость. Также гипертоническая болезнь, ожирение. 63 года. Заболела остро, высокая температура до 40 градусов, ничем не коррегировалась температура, высыпания на лице появились на 7-й день болезни на фоне нормализовавшейся температуры. В анамнезе гипертоническая болезнь, ожирение. Вот единственная из данной подборки пациентка молодого возраста, и 40 лет, тоже высокая температура, ничем не коррегировалась, высыпание 7-й день болезни, но вот у нее также гипертоническая болезнь и ожирение в анамнезе. 58 лет пациентка, заболела остро, высокая температура, высыпание на 7-й день болезни, гипертоническая болезнь и ожирение. На самом деле подобных пациентов у нас на данный момент уже больше 30. Я подобрала самые интересные клинические случаи. Появление розациоподобных высыпаний на лице следует расценивать именно как специфическое раннее проявление метаболических микронарушений периферической васкулярной системы в зоне расположения множества мелких сосудов, обостренной ковидной болезни. В основе же этого явления, вероятно, лежат дистрофические процессы печени, обусловленные повышением уровня гомоцистеина при одновременном дефиците аденометионина. И с нашей точки зрения это также может способствовать наличию у пациентов наличия в анамнезе гипертонической болезни, диабета и ожирения, что само по себе создает благоприятный фон для ослабленной вирусом сосудистой стенки. Также интересно заметить, что участие пациентов в течение 2 недель, некоторых месяцев, высыпания проходили, участие пациентов, эти высыпания сохраняются до сих пор. То есть прошло от того, как мы начали это исследование, уже где-то месяца 2, и высыпания у этих пациентов сохраняются до сих пор. По мере изучения постковидного синдрома стало очевидным, что необходимо обращать внимание на состояние кожи. Изменения на кожном покрове, по нашим наблюдениям, могут с наибольшей вероятностью возникать как одно из наиболее ранних по времени проявлений поражения сосудистой стенки. Вероятно, это происходит несколько ранее или же одновременно с поражением внутренних органов. Эти проявления можно рассматривать как один из ранних проявлений постковидного синдрома. Я благодарю всех за внимание. So, Christian, it's a word to you now. Hello.
Thank you very much, Katerina. And I'm sure I really don't to understand, that I don't want to tell you it was interesting because I don't know, but I am sure about it because I was able to follow some things, and especially clinical cases. And I think that COVID-19 really is impacting dermatology, because yesterday there was a new paper published by a group of Latin American doctors, from 25 countries, and in the International Journal of Dermatology. It's a very interesting paper. Regretfully, it was published yesterday. I had no time to insert it in my presentation. But the most important is that when a patient is suffering COVID-19, in 97% of cases, there are dermatological symptoms, and not only systemic symptoms, but also dermatological. So I think it was really a very good experience for dermatologists, this pandemic, and we must keep updated about this, because things are changing. Now also, because of vaccination, we have some dermatological symptoms, and we must take care about all of this and keep updated. And so now I will share my screen with you.
Mm-hmm.
Let me check because can you see it?
Yes, I can see it.
So, and what I chose to do, because I don't want to, you can see it still, yeah?
Yes.
Yeah. So, I don't want to repeat more or less what Katerina told, and I decided to do something a little different about this, and see how our new life, it's quite a new life, because 2 years ago, this kind of devices, like alcohol in gel, like face mask, you could only see it in hospitals and nothing else, and now you can see it everywhere. Everybody has to wear a face mask, everybody has to disinfect his hands, it's very important, and really our life changed. And this was también a question of changing of physiological characteristics of the skin because of this of wearing face masks. And there is a very interesting study in Korea with participants wearing KF94 mask during 6 hours per day. You know, usually when people are working, it's at least 6 hours, and we are focusing on working people, especially because at home it's completely different. And this study was taking into account voluntaries wearing the mask 6 hours per day, and the result not only after 6 hours but also after 6 weeks. And so you can see something that the first parameter was skin temperature, and you can see that what happens after 6 hours, there is quite a good increase of temperature by 2 degrees. It's quite an important increase. Also, an increase in the red component, in the redness of the face. You know, wearing a face mask is provoking redness, and not only rosacea, not only acne or inflammatory diseases, we'll talk about this later, but also common redness, you know. On the contrary, the dimension of pores is not changing. The same for skin roughness. It doesn't affect skin roughness. It doesn't affect skin elasticity. But look at this one. Transepidermal water loss, you know, dryness of the skin. Water loss is increased a lot. And what does it mean? It means that the skin will be drier with wearing the mask. And another dramatic result, you know, dramatic increase is about sebum production. And this is really maybe the most important factor as a consequence of wearing a mask during this pandemic. On the contrary, pH is not so different of what it's usually. And you see, after 2 weeks, its intermediary result, there is a loss of elasticity. And the same, there is a higher dimension of pores. You know, what we were checking here was after 6 hours, but when time is spending and you talk about weeks and weeks, you see that parameters are different, and especially number of acne lesions is increased, you know. But check something, there were acne lesions at baseline. This means that the patients had acne previous to pandemic, you know, and previous to wearing the mask. And in this case of having acne previously to start of the pandemic, there is an increase in acne lesions. And you know that there is an interesting, this is another one, it's also a Korean study, you know, after wearing the mask 6 hours a day, 4 weeks, and the parameters under study are different, you know. They are taking care about skin wrinkles, skin pores, and about also a questionnaire with the volunteers about what changes did they feel, you know, during the pandemic. And the first thing is about skin wrinkles. And there was not a big change. You see that it was not so important. There was a small increase, but not so much. There was a higher increase about the size of pores, you know, which is really a concern for the people, of course. And you see that there is some kind of change in aesthetic conditions of the skin. And what do people think about this? Do you think wearing a mask affects your skin? Totally agree, 65%, you know, and really not only we can measure these changes, but the people feel it, you know, and this is very important. And only 20% are not agreeing, and they think that there is no change in their skin in spite of wearing face mask. And you see what happens during the pandemic, I told you, is an increase of acne outbreaks when wearing the mask. And especially in the places, you know, where the mask is. If you have acne on your chest, there is no change because your clothes are the same during Covid time or outside. But with the mask, when the lesions are located on the place where you are wearing the mask, then you will have increase of acne outbreaks. And you know what? Not only increase in outbreaks, but also flares of acne. You see here in this publication some examples of patients with increased acne flares, and also this is different, but this is also bad news for the patients, you know. There may be occurrence of acne in patients without previous acne. And this is a very bad thing. People who never had acne before are now with acne because presumably, you know, because maybe and almost certainly because of wearing the mask. And this person is a bar employee. She is using a mask during her whole 8-hour shift, of course, because she is in contact with public, you know. And previously to this episode, she had facial seborrhea, but never acne lesions. And in this case, after sometimes it was after 4 months of wearing the mask on daily basis, the clinical examination of this patient showed numerous purples, pustules, and microcomedones. You know, all the signs, all the symptoms of acne, and all of this caused by wearing the mask. And this new entity, let's tell, this new form of acne has a very nice name in English, is maskne, you know. And maskne is a new entity in dermatology. It appeared during Covid pandemic, and of course, you see there are various shapes of masks and various types, and depending on the type, acne will show on your face which mask are you using daily. And now there may be also erythematous eruption when using a mask, like in this lady. This lady was disinfecting her face with ethanol 60%, 5 times a day, and using a mask during 6 hours. And I'm not sure, you know, that there is a need for disinfecting the face with ethanol as often as she was doing, you know. And because of this, she had erythematous eruption on the face. And of course, you must do it with hands. And also in case of hands, we'll see it, there may be erythematous eruption. And this is very important also. There may be occurrence of rosacea in patients wearing a mask, you know. And this lady had no previous rosacea, you know, and this rosacea appeared 2 weeks after starting confinement in Italy and after starting the obligation of wearing face mask. And she had only a previous history of flushing, but not of rosacea lesions. And you see that now, after wearing the mask, she's displaying erythematous lesions and erythematous rosacea. And this lady was treated with doxycycline 40 milligrams during 12 weeks, and she was successfully treated. You know, this shows something. This kind of acne of rosacea, which is caused by wearing the face mask, is the same entity as common rosacea, you know, and the treatment must be the same. You have also this case, which was reported by our colleague Volina in Germany, you know, and this patient is 56 years old and no clinical history, you know, exclusion of diagnosis of allergic contact dermatitis, you know, by patch test. Patch test was negative, and the diagnosis, and we can see it and we completely agree, was papulopustular rosacea. And I don't agree about the treatment. You know, it's not a usual treatment. It was metronidazole 1 gram per day during 2 weeks and pimecrolimus cream. And I don't agree so much, you know, because in such a case, for me, the first line treatment would be more likely a topical treatment, you know, maybe with ivermectin cream or with something like metronidazole. But anyway, the patient was healed, but in terms of papules and pustules, but erythema persisted after the treatment, you know. Really, this was caused by wearing the face mask, and it was not possible to treat it completely in a satisfactory way for the patients. Well, this is very common, you know. After that, we'll see statistics about the side effects of wearing face masks, and the most common one is exacerbation of lesions of seborrheic dermatitis. This patient, 29 years old, had this case. You know, we see very well that the lesions were exacerbated at the place of wearing the mask, and the treatment, successful treatment, was a topical corticosteroid for 5 days, you know, like strong starting treatment, and following that, topical 1% pimecrolimus during 10 days. It's quite easy to treat, you know, but it's very common. It's a very common side effect of indirect side effect of this pandemic. And you see, sometimes it may be very serious, you know. Really, there is a very serious exacerbation of seborrheic dermatitis in case of this patient. Well, now I was talking about the statistics, you know, because we are talking about anecdotal cases and so on, but we have to know exactly how much it may represent. Worsening of lesions of seborrheic dermatitis, I told you, are very common. In an Italian study, up to 46%. In a Chinese one, up to 36%. But anyway, around 40%, it's a very high level. Lesions of acne, it's also very common, you know. In 43% of cases, there is increase of symptoms of acne and worsening of the lesions. Rosacea, in all patients with rosacea, in the Chinese study, it was asserted that wearing the mask was worsening the symptoms. Pruritus may occur also in around 15% of the patients wearing a mask. Erythema, we told it with the lady, you remember, around 12-13%. Occurrence of dry skin, you remember that the Korean study was assessing that there was an increase in transepidermal water loss and then drying up of the skin. And this was also reported in reality, and other things. But you know that worsening of lesions of occurrence of pruritus, erythema, and skin dryness account for 49% of patients. So it's a very common thing, and we must be used to it, we must get used to this because patients are coming to the office and are asking about this, and we must have some kind of response for the patients. Well, there may be also contact dermatitis when wearing a mask, and possible allergens may be dibromodiazinombutan, which is a preservative in the mask, formaldehyde, it's a very well-known allergen, very common allergen, which is used in the manufacturing process. Furan, which is present in the elastic of the mask. Cocopropylene diamine guanidinium diacetate, which is another preservative in the mask. There may be residues of polyurethane, part of the manufacturing process. Triglyceride isocyanurate as a hardener, to keep the strength of the mask, and bolopol, which may be an impurity. You see that in only one mask you can find quite a good series of possible allergens, and this kind of contact dermatitis is not infrequent, it's not very common, but you can see it. It's quite usual to see it. And you see that this kind of contact dermatitis may be very severe in some cases. And really, we must think about, of course, about the mask and about changing it and about making a patch test, adequate patch test with the possible allergens we mentioned. Well, now I told you very briefly about washing hands with alcoholic gel, and this is a very good thing, and we must not avoid to do it, this is compulsory in a time of pandemic, but you can have sometimes erythematous patches, the same as the lady you remember on the face, you can have it also on the hands, and you can also have contact dermatitis, and this is more common with isopropylic alcohol than ethanol, There is very few contact dermatitis with ethanol, but with propanol, you can have it much more. And this, you see, now let's focus on healthcare workers, because we have to honor them. They are in first line, and they are suffering a lot because of this pandemic, helping everybody. And of course, they have to use alcoholic gel and face mask a lot. And frequency of hand washing during a regular shift, 79% of healthcare workers are washing their hands more than 10 times. And we know about this, when we are in an hospital or doctor office or so, we are all the time washing our hands. And 19% between 5 and 10, and only 2% or 1% 1 to 4 times. So there is a very strong frequency of washing hands, and for this reason there will be consequences, on the hands, like redness, like soreness, like skin cracks, peeling, scaling, swelling, quite a lot of bad side effects on the hands, and especially on the back of hands, web spaces and fingers. This is the 3 places where these changes and side effects are more frequent. And about the face, about wearing the mask, in this case, there is a soreness, redness, we told about it, dryness, we told about it. It may be blistering, but it's very infrequent. Blemishes and skin thickening, and especially on the nose and cheeks, of course, because this is the place which is covered by the mask. And on the contrary, ears are not covered and forehead is not covered anyway. And you see that these signs and symptoms are quite frequent, and depends on the mask. This kind of surgical mask is probably the best one, in order to prevent these side effects. But if you are talking about FFP3 mask, then you have much more signs and symptoms of soreness, redness, dryness, blistering, blemishes, and skin thickening. And this is another question, we don't talk about it, and I think these Indian investigators had a very good idea, They published this report, this paper, about increase and consequences of self-medication in dermatology. What happened, and in India, especially now, of course. What happened? Doctors' offices were closed during months, and there was no attendance, for dermatological patients. And what happened? The patients had to go to self-medication, and the patients are not dermatologists. They don't know about this, and they cannot prescribe by themselves oral corticosteroids, topical steroids, antibiotics, antifungals, methotrexate, hydroxychloroquine, antihistaminics, it may be more, but all these entities, need a medical prescription. And we can think, we can imagine that following such a wide auto-medication, self-medication, there have been and will be consequences, and we must be prepared for this. And now about the vaccine, because fortunately, more and more people are vaccinated, and we are seeing some dermatological side effects, some dermatological reactions. For instance, with Moderna vaccine, you have contact dermatitis in some cases. You have injection site rash, like here, and urticaria. These are the most frequent, most important side effects with vaccines. I took Moderna vaccine in this case because of this publication of this paper, but there are also other papers, I didn't want to repeat it, with other vaccines like Pfizer or AstraZeneca, and all the results are more or less similar, you know, and these three cutaneous manifestations are the more frequent following vaccination. And look at this one. This is very interesting. It's not frequent, but at some extent, you know. This is a side effect of COVID-19 vaccination, you know. This lady was with vaccination, and 2 days later, she wanted lip plumping, you know, and she did it as a procedure with hyaluronic acid, and you see what happened. Lip angioedema, quite important following this filler injection, you know. And there is a consensus that if someone had a vaccination for COVID-19, you must wait at least 2 weeks before any filler injection, you know. On the contrary, you can get such a side effect. The explanation is not very certain, you know, but we think that by increasing immunity, you know, the vaccination is also increasing the possible reaction to injection of hyaluronic acid. But keep this in mind, you know, because really you can avoid it very easily. You must wait for 2 weeks and nothing else. And of course, we had changes in our office, you know, and we must think about first protecting our employees, you know, by using some glasses when it's possible, you know. Of course, they have to use a face mask. They must disinfect their hands, as everybody. They must avoid direct contact with the public, you know, with the patients. And we must protect ourselves, you know, also. When the patients, before they enter the office, they have to disinfect their hands. They have to wear face masks and so on. And we must also protect our patients. And the doctor office will be a little different, you know. There is not a mountain of patients waiting in the waiting room, but we must give them some space, you know, and avoid very close contamination in this case. So about SILDERMA products, you know, during this time, because this event was sponsored by LSI SILDERMA, in case of occurrence or worsening of lesions of seborrheic dermatitis, Quasix gel. In case of worsening or occurrence of lesions of acne, the same. Cream in case of rosacea, you know, when de novo rosacea or existing rosacea is worsening. And for the occurrence of contact dermatitis, erythema, pruritus, and dermatitis, we have very good results with Sodermix, you know. And it's not a mere advertising, but it's based on many doctors' experience. And I can guarantee that in these cases, these products are doing very well. So I thank you very much for your attention.